this is the way that we should be preparing our objectives, so that in the end we should know that these are the actual outcomes which we want, and we want our students to be competent, or students to develop some skills so that they are actually able to do something of higher level. Okay, let's move forward. First thing first, let us start with an icebreaker. I just want you all, you are able to see slido.com. You can just go to slido.com, or you can click on this QR code. If you can click on this QR code, not click, you have to click the picture and you have to go into that, or you can just go to slido.com on your laptop and put this code in that. And please try to give the answer on Slido. So you have to write an innovation in your teaching which you always wanted to try but could not till now. Reasons might be anything, but any innovation which you feel that you wanted that it should be incorporated, but you could not till now. If you have any problem in Slido, please you can go to slido.com. As of now, nobody has joined slido.com. Please try. Yes, somebody is typing. Very good. Please, everybody, I want everybody to join. Okay. First one is ABJ analysis scale for beginners. Others also, I want everybody to write. Please try to answer about your innovative pedagogy. What innovative pedagogy you want to try but could not till now? Be fast, please. I hope you are able to join slido.com and you can just keep on writing. Okay, gamification, very good. Others? Very good. Simulation based learning. Flipped classroom model. Okay, integrated with simulation based learning. Great, great. And getting really great answers by means of visual effect and real environment. Good. Simulation based learning. Anybody else want to join in? Anybody else want to add? There are, I think, approximately 250 participants, but as of now, I have got answers only from 6. See, our lecture should be interactive, because when we are talking about innovation, we have to be innovative, we have to be open minded, right? So please try to join in. Problem based learning, very good. Okay, so thank you so much, everyone. I think I'm really happy to see that all of you use of AI in competency building. Very good. So you have actually come out with really good innovative cloud-based collaborative, so it's very good. So you have that understanding that what should be incorporated in teaching, and all these innovations which you have written are very easy to be incorporated into your teaching. But there might be so many different barriers which you might be seeing, I think so. uh, for that we have to have little bit of open mind. We will be able to use, we will be talking about all these aspects, the innovations which you have noted down here. You talk about simulation, you talk about collaborative activities, you talk about problem based learning, gaming, very good, OSCE, that is assessment method, innovative assessment method. So I think uh, there should not be any barrier for using such type of innovative teaching, because these are very easy to use. So I hope that after the end of this lecture, whatever innovations which you have written but you could not try till now, I'm sure that you will be able to use that in your teaching, particularly LMS. Very good. Nowadays a lot of good LMS uh, uh, interface through Google. You might have known about Google Notebook, right? So we will be talking about that also. OSCE, different aspects of assessments that you can really utilize. Only thing is we have to have an open mind. We have to think that at least one innovation I have to include first, and then I will be scaling further on more and more other activities. Right? Very good, very good. Video based micro learning, practice based through the AI. So we will be discussing about all these things. I just wanted to know that what is in your mind. What do you think about innovation? So definitely, I'll be including all of these in my lecture today. Okay. So now moving forward, let us see that why must nursing education evolve?
उधर
Why
से
there?
भी टक करना
Please
इधर से
mute yourself, everybody. Why must nursing education evolve, and what does innovation actually mean for curriculum? Why it is needed that we need to evolve? Why there is need for innovation? So let us talk about that. Why innovation is needed, I feel two aspects. One is our healthcare system drivers. Please keep yourself muted. If the co-host can mute everybody. You can mute everybody through host controls, please. Okay, so healthcare system drivers, and also at the same time, the learner's profile is changing. If we talk about our times when we were students, okay, so that time we had different mindset. We were not having a lot of opportunities available, and at the same time healthcare system is changing a lot. If we talk about healthcare system drivers which are needed for innovation in nursing education, first and foremost is rising complexity. Okay, rising complexity, because nowadays,
मैम शायद वहां आ रही है पीछे हॉस्टल बन रहा है ना जो उसको देखने आ रही है
please mute yourself, madam. Okay. So rising complexity, because nowadays patients are having multimorbidities. If any patient comes with hypertension or diabetes, he might be along with that. He might be having some another NCD like diabetes. The person might be also suffering from sometimes mental illness also. And then there is aging population, and aging population is always having multimorbidity. So this is not that a student or a nurse who is working in the hospital should be able to understand to take care of one person, kind of disease only. They should be able to know that this person might be having complexity, they might be having multimorbidity, and how I have to take care of all kinds of issues or all kinds of problems which the person is having. And particularly when we are talking about NCD burden, lot of complexities are there. You may have to manage high blood pressure along with some renal complications, along with some uh, blood sugar control also. So the person, we need to prepare our students in a way that they should be able to manage the complexity of the diseases, right? Then second thing is shift to community primary care and home based care services. Now you might be uh, whenever you're going to social media also, or whenever you are opening any kind of website, you see that now shift is from tertiary care management to self care, particularly making the people aware about the prevention of disease. Okay, so now shift is towards more community based care, primary care, and home based services. And in this shift, nurses play a vital role. Okay, because nurses are at the center of this care whenever we are talking about health education, uh, awareness, whenever we are talking about primary care, whenever we are talking about home based services. So we need to prepare our nursing students for such type of roles. I would like to mention here, like, two of our students, when they passed out after BSc, they started a startup. Okay, and that startup is for home based care, and their startup is working like anything. So they are able to provide the um, healthcare people at the home. So people can, from their app, the persons at home whosoever need any care, they just, like in Practo, or in Apollo, you are able to get the online, through Practo you can get the online services. The same way, home based services the people can get through their app. So we need to prepare such people who are actually in the center of that kind of care. Then third thing is patient safety mandates and quality of care benchmarks. Nowadays, if any person is working in a clinical area, majority of the hospitals are NABH or JCI accredited. Okay, so there are benchmarks. There are a lot of mandates for the patient safety. Okay, so we need to prepare our students for such kind of uh, healthcare organizations where they should be able to manage properly all these mandates and quality of care. Then is interprofessional team based models. Nowadays, nowadays kya pehle se hi the people have to work in a team, in hospital or in community area. Nobody can work in silos. Okay, so we have to prepare our students for team based models of care, where they are able to uh, work in a team, so that they are able to manage the healthcare issues with their proper critical thinking and clinical decision making. Then rapid uptake of digital health, we need to prepare our students to we have to prepare them for the digital healthcare. Okay, where telehealth is an integral part, EHRs, wearables, AI assisted diagnosis. They should be knowing that what is it, and how can we be part of this digital health innovation, right? Then is global mobility of nurses and demand for internationally benchmarked competences. Because nowadays, I think so in Punjab, particularly, if you talk about my institution, I think so 70% of students, they are going abroad. They We have to prepare them for global market. Okay, because nurses are moving abroad, and they should be able to transition to that international environment also very well. So we need to prepare according. So that is why our education system cannot be a system where we are using very traditional methods. We have to be little creative and innovative, so that our students actually can become competent and expert nurses once they go out. Okay, now talking about learners profile. Learners profile, particularly, nowadays, the student Gen Z, we are getting Gen Z students. Just a minute. We are getting the Gen Z students, where the students, they are digital natives. They are, from starting onwards, they are using uh, social media, they are using mobile phones, they are using AI also. So they want quick answers. Okay, they expect that interactive mode of delivery of education should be there. They can't be sitting and just listening. Their attention span is very very short nowadays. They don't like the passive lectures. Okay, they respond more to micro learning, means where you are splitting the complex topics into simpler and then small bits in bits you are teaching them, so that they are able to understand actually in depth understanding, but in short span of time, and very easy understanding. Okay, so they can't sit for 1 hour 2 hours lecture and then they can't listen to a teacher. Okay, and they value real world relevance. Okay, if you are able to connect them with your real life experiences, then they will be definitely very receptive, they will be very engaging, and they want immediate feedback also. If they are doing something, they want the feedback then and there, whether I did rightly, what were the points I need to improve. Okay, they want immediate feedback also. And moreover, there are diverse entry pathways in nursing. You know, you may have some diploma student, you may have some undergraduate student who is joining into post BSc, and post basics are different because they have a basic understanding. So you need to evolve in your education. You can't use same method for each and every student. I'm sure when you are teaching a master student, you are teaching in a different way. When you are teaching a diploma student, you are teaching in a different way. So you have to have some different method to engage the students. And nowadays, you know, increasing anxiety, stress levels, that is not only in nursing but everywhere. So whenever we are teaching, we have to prepare them as a resilient person who is able to manage the stresses of every day. And at the same time, you are also preparing them to become resilient so that they can come out of the issues, the stresses, uh, and then they are able to manage that very well. Okay, so you need to be supportive. You can't be authoritative. You have to be supportive. You have to understand their point of view also. Okay, then high comfort with social media, short video, AI chatbots, chat tools. Now they know the digital world. Okay, why not to involve that digital world into their teaching also? Because they would like to see the short videos. Even if you're teaching anatomy and physiology, you're teaching infection control, definitely if you will be sharing them some videos before the class, they will be better able to prepare themselves. They understand in a better way. If you involve some AI into your lectures, they will definitely like that, and they'll be more engaged. So that is because of this changing healthcare and learners landscape, we need to prepare ourselves for that innovation and creativity, right? Now let us talk about that how uh, traditional curriculum is different from innovative or transformative curriculum. Now, in the end, I will ask you one question: whether you are using traditional curriculum or innovative curriculum, you have to give me the honest answer. Now, you see, whenever we are talking about traditional curriculum, you know, it is always lecture centered. The teacher just sees that this is the topic which I have to prepare, and mostly when they go into the class, they just deliver the lecture. Okay, that is lecture dominant delivery, where lecturer is speaking, and students are just passively sitting and they are listening. Okay, and content coverage driven syllabus is there. Definitely we need to see, we see that these are the 20 topics which have been given to me. I have to complete these 20 topics in these many hours, and if I have covered the syllabus, it means my work is done, right? Then discipline siloed subjects, we teach mid-search totally different. We teach community health totally different. Okay. In isolation, we teach the discipline subjects. Okay. And then knowledge recall emphasized in exams. You know, we just give exam where there are short answer questions, long answer questions. Students just whatever they have learned 2 days before, they'll just go and vomit out into the paper, and in the answer sheet we just check it, and then we give the marks. That is a knowledge recall. Okay. Then static textbooks and periodic revision cycles. There we use different textbooks. There might be revision cycles, but then we don't include technology in that. Then skills taught primarily on real patients and wards, and particularly we take the students into the real world, into the clinical area, and there we are teaching them the skills on patients. Okay. Then assessment, there are high stake written exams, big written exams are there, which is mostly 25 and 75, like 25 internal assessment and 75 external assessment, and that is high stake written exams are there. Based upon that, students have to pass. Okay, that is a traditional curriculum. Now let us talk about what happens if we are talking about innovative and transformative curriculum. Now here It is not a teacher centered, it is learner centered, active, and using the collaborative methods. So here, students are active part of your teaching. There is a lot of interaction and engagement involved in that. Okay, you involve some activities where you are collaborating with the student. Okay, and it is outcome and competency driven, means backward design. Here you talk about your graduate attributes or your outcomes at first, and then based upon the outcomes, that what should be my delivery of the teaching, and what am I expecting that student will have this skill after completion. That is known as the backward design. So here we go for the backward design of curriculum. Okay, then integrated interprofessional and contextualized learning. Here the learning is integrated. We don't teach, although in the starting we can teach the subjects separately, but in the end, at least these should be integrated together, so that, you know, this never happens that in community health, whichever we have learned, we will not utilize that knowledge in hospital, or in hospital knowledge will not be utilized in community. Everything is interrelated. And sometimes in medical surgical ward also, if you are working, you may have to utilize your mental health subject also. There, those concepts also may be helpful there when you are managing any patient in medical surgical also. So that should be integrated, interprofessional also, because in hospital you are not working in silos. You are working with the team. So interprofessional learning and contextualized learning. Contextualized means different context type of learning. If you are in community, what are you supposed to do? If you are at the home of the people, what are you supposed to do? In hospital, what are you supposed to do? Okay. Then application, clinical reasoning, and judgment emphasized. So here, transformative curriculum should be more application based, more clinical reasoning based. Okay, students should be able to manage any critical situation in the clinical area by using their clinical decision making. Okay, I still remember the day one when from my BSc, when I straight away joined in army after completion of my um, bachelor's. Ours was the first batch which was taken from civil to military nursing. So there, when I went, I was really tense, because suddenly I was left alone. I have to take care of 40 patients in a ward, and everything has to be taken care by a nursing officer. And I was really worried, because although I did from PGI, there were a lot of patients were there. I have learned hands-on. I had a lot of hands-on practice, but still, I was really worried, because I was not prepared for clinical reasoning. I was not prepared for clinical decision making. So our curriculum should be such that when student is transitioning from their studentship to the service side, they should be able to apply whatever they have learned. So, but that learning has to be in the college only. The learning has to be in the education system, where they're able to understand that what is clinical decision making, what is their judgment. If this is happening, what is happening, what to do. A person might be knowing that if this drug I am giving, for example, if metformin I am giving, these are the side effects. But whether that student is able to know that if these side effects are there, what am I supposed to do? Do I need to withhold that medication? Do I need to report to the doctor? That is the clinical reasoning and judgment. Do we teach that clearly to the students through case scenarios, through simulations? Okay. Then dynamic technology enabled continuously updated content. That is very important, that the curriculum is always dynamic. This is not a thing that curriculum is in our hands, we have to just complete the topics. No, it should be continuously updated, because as per industry needs, as per healthcare evolution, we may have to include some topics. Okay, then simulation and skill lab based progressive practices. Now it is good that Indian Nursing Council has come up with competency domains, and they have made it mandatory that simulation hours have to be included. Okay, now 30% of your total clinical hours can be completed in simulation. Make sure that once the student has completed that subject fully, in that at least 30% of your clinical hours should be utilized in simulation, where students can actually learn this clinical reasoning and clinical decision making, right? And then it is multimodal, continuous, and authentic assessment. Assessment should not be only that in exam they are able to write, or in practical in viva they are whatever they have just understood they are able to in your viva they are able to answer that, or only functional assignments they are able to do. No, there should be something related to OSCE, objective structured clinical examination, where you have different stations and different kinds of activities which you have to do. Then their portfolios, we will be talking about that also in the end. So that is particularly innovative and transformative curriculum, which will actually prepare the expert uh, nursing students. So what are the core principles of innovative curriculum design? I have already told about backward design, where we begin with our learning outcomes. Then what do we want, that if the student has completed BSc nursing, what will be our intended learning outcomes for this student? Okay, what are the graduate attributes, or what are the INC competencies which we want, that students should be competent in all these things? Okay, and then based upon that, the design of our education should be planned. Okay, then we design our assessment and final learning experiences, and that is in our hands. Our curriculum is prepared very well by Indian Nursing Council, but how are we delivering that content? Are we delivering it from the point of competencies, or just by the topic which we have to cover? That is mainly very, very important. Then integration and spiral curriculum. Spiral curriculum means the same. For example, the concept infection control we teach in foundation, or communication we teach in foundation, but once the student goes in second year, third year, fourth year, in every subject infection control we talk about with little more complexity. So complexity keeps on increasing. That is known as integration and spiral curriculum, where you teach those concepts, but then don't teach it in isolation, that infection control has to be taught fully isolated. No, it has to be incorporated in different subjects with the different level of complexity depending upon your curriculum when it is moving from simple to complex, right? Then contextualization, this is very important, that whatever you are teaching, it should be contextualized to your local culture. Now we are in India. Even if we are reading a book like Potter and Perry Foundation, but then foundation can be for different concepts, but at least our Indian concept, where we talk about Ayushman Bharat, where we talk about national competency framework, where we talk about competence, community health needs. Our community health needs might be different from Western world. So we need to talk about local epidemiology, local health policy, so that students should be able to contextualize. Okay. Then learner centered. Already said in my last slide also, that here the shift is from faculty role to the learner. Okay, where you uh, actually want that learner in the end of your subject teaching should be able to do these things. Okay, and this is not that only for writing, it is actually that students should be able to do. That is why we say that shift the faculty role from sage to stage. Okay, then technology integration, very important. Ajkal, if you will not include your technology into your system, then it means you are really backward, going backward. Okay, so you should use LMS, you should use simulation and AI tools, and it is not difficult to use. Okay, we will be talking about that also. So you use sound pedagogy, where your traditional methods may also be incorporated along with the technology. So you integrate it. Okay. Then continuous curriculum review. I'm sure that nowadays majority institutions they want to go for accreditations like NAC accreditation. There we actually take the regular stakeholders feedback. Students are taking clinical training. So you take the feedback and try to see that where are we lacking, because mostly whenever students go from institution to service side, majority service side people, they say that students are not prepared for clinical. Where is the problem? We have to understand. Okay, so that cycle, PDCA cycle, plan, uh, plan, do, and then you have to act. That cycle has to be completed. Okay, take the feedback and you refine your curriculum accordingly. maybe sometimes topics, everything is there in your curriculum, but you may have to refine your way of delivery of those topics. Okay, so these are the core principles of innovative curriculum. Now, till now, if you have any question, you can ask me. Then I will move forward to the next part. Any question? Am I audible? So,
Yes,
if
ma'am.
right, thank you. So, if you don't have any question, let us move forward to the section 2, which is competency-based curriculum design. Please mute yourself. Please mute. Okay, so let us talk about competency-based curriculum design, because I'm continuously talking about that we need to prepare the competent nursing students. We need to feed our national competency framework into some measurable curriculum. Okay, so the please, please mute yourself. Please mute yourself. I would request co-host to mute everybody from host control. Okay, so competency-based education. Uh, what it does is that organizes curriculum, instruction, assessment, everything towards the abilities, where the abilities of the students are demonstrated. We everything which involves knowledge also, which involves skills, which involves attitudes and judgment. Okay, this is not that these many hours has to be um, these many hours have to be spent in educating the students on these this content. No, that is not competency based education. Competency based education is that you are integrating your knowledge, skill, attitude and clinical judgment together, so that student is competent enough to manage uh, the different challenges, whether it is usually what happens, we just measure the progress by some credit hours, that whether the student is able to complete these many credit hours, then it means the student have understood everything, so it means the student can move to the second semester. But that is not a competency based education. Competency based education, the progress is measured by mastery of defined competencies, whether the student is proficient enough to do something, to for example, whether the person student is able to perform a comprehensive health assessment safely and accurately. It means the student is having mastery in comprehensive health assessment. So here we have to be outcome based, where like we have logbooks. What do? Logbook mein what do we do? School teacher has demonstrated, we just write demonstrated on this day, and student has demonstrated. But whether in demonstration, are you checking that whether every student is able to do it safely and accurately? Even if there is one health assessment only, whether the health assessment the student is able to perform from starting to end completely or not. Okay, there might be some students who might be doing in a better way, but then the students who are not able to do, you have to do it. You have to make the student to do it again and again till the time mastery is not there. Okay, so that is very important in the competency based education. So this competency based education matters a lot, particularly here, because now INC has given the competency based curriculum. If you see the JNM BSc syllabus, they have given different competencies in which students are supposed to be competent enough. Okay, and then national essential competency framework is also there, which is for healthcare professionals, that they should have these competencies, which is not only the functional abilities, but it also involves practice ready graduates who can transition smoothly into global pathways also. Because Indian nurses are moving abroad. Are they able to manage transition fully into that global pathways or not? Some students might be struggling to understand. So here the picture it comes slow and advanced learners. Slow learners might be needing more remediation methods, where you might be coming up with the remedial classes for them. Maybe on Saturdays, extra classes for those students who are struggling. You can help them to work more in the labs. To the case scenarios, you can teach them. Okay, and for advanced learners, you may ask them to do some advanced level online education systems also, where they can get some certifications. Okay, so for both you have to manage accordingly. If slow learners is there, give them on learning more skills, more activities should be given to the advanced learning, so that they should not stuck with the slow learners. They can keep on learning at their own pace, but for struggling students, we should be there to support them. Okay. Then provides clear, transparent benchmarks for clinical preceptors and external examiners. So if competency-based education is there, then clinical clinical demonstrators and clinical instructors and external examiner, they know that we have to assess this student on these competencies, so which is very clear. And nowadays for competencies, I'm sure that majority of you might be going for OSCE examination, and through OSCE different stations and different kinds of activities we include, which actually help. Actually, we try to incorporate different kinds of activities in OSCE, so that each and every competency can be assessed based upon their level of education, right? Okay, this is the INC competency framework. I'm sure that majority of you might have seen that these are the educational competencies, a framework which is given by Indian Nursing Council. The first and foremost is professional, ethical, and legal practice, where the students have responsibility for the clinical practice. They are accountable. They have to follow some ethics. So this is not that student knows how to do it, but at the same time student should be ethically doing it, because students not only ethically but he is legally responsible also. Okay, so that is also very important, that students should understand that what are their professional code of conduct, what is ethically right and what is legally right, so that they are safe when they are working in the clinical area. The nursing practice, very important competency, that is clinical skill. Is student able to do the clinical perform the clinical skills in the clinical area fully or not, with mastery, whether the person is able to do or not, which includes different kinds of clinical skills, whether medical surgical critically, one, and what side effects have to be checked, what should be the next step which should be done, when it should be reported to a doctor, so that timely the patient can be managed. Very, very important. Then communication and interpersonal relationship, very important, because communication is very important when you are in hospital. Professionals, how are you communicating with the dietitian? So that is very important. So particularly whenever you are, I think, in communication, therapeutic communication, don't forget S bar for handover is very, very important, where you will not miss out anything. You have to see what is the issue, what is the situation, what is the background, what have you assessed, and what are the recommendations. That is very important. If you are including S bar, manage the health issues of the patient. Then leadership and management, very important. How do you coordinate in a team? How do you delegate? ये नहीं है कि everything you are doing. You may have to sometimes delegate also the administration. And then that delegation with complete clear communication. Okay, how are you managing your resources? How are you managing your time? Very, very important aspects, which we sometimes, whenever we talk about competency, we talk only about clinical skills. But competency is not only clinical skill. Competency includes all these things. The sixth point is education and research. Do you know how to teach, how to give health teaching? What is evidence based practice? Whether you are in teaching, whether you are in clinical area, you are, or in administration, research is an important skill which you should have as a healthcare professional. So, research competency is also very, very important. Then, professional development. One should be a lifelong learner, whether the student knows that after the completion of after the completion of bachelor's or master's, still they need to keep on updating themselves. Like nowadays there is exit exam. They are thinking that there will be an exit exam for BSc nurses, so that they should be licensed only after the exit, after the completion of the exit exam. That is particularly to see whether students are competent to practice in the clinical area. But at the same time, after that also a lot of things will be changing, like COVID-19 thing. We all learn how to manage a patient of COVID-19. Okay, so if you will not learn, then you will not be able to manage certain situations. Okay, so professional development, continuing education, mentorship, everything that also comes in the competency framework. Then personal and professional attributes. Are you empathetic? Are you culturally competent? Are you resilient? What is your professional identity? I always say that nurses should also have their own brand. They should be visible that what extra they are doing. We should not be keep on doing our work invisibly. Whatever we are doing, it should be visible to the world that they are doing something good. Like this new movie has come, it has made the nurses visible that they are actually doing something extra. Okay, so that visibility is very, very important. That is a competency, which competency under the competency framework, which is personal and professional attributes. So we need to prepare our students on all these competency frameworks. These are the core domains. So not only we have to focus on clinical skills, but we have to focus on all these things. Okay, now coming to another activity. Please open slido.com again. So the previous slide, we have talked about the competency domain. Okay. Now you have to choose one competency domain from the previous slide that you find hardest to teach effectively, which is difficult. You feel that it is very difficult to teach effectively. Then, along with that, you share your competency strategy. That what can you do so that that competency strategy can be that competency can be developed, and you can teach that. Please read the question fully and then you start answering on Slido. You can again go to slido.com and start answering. Are you able to join Slido? Please join fast. Is there any problem in joining Slido? Am I audible?
Yes, ma'am, you are audible.
Okay, so please do it on Slido. Everybody, please do it fast. At least you write one competency domain which you feel hardest to teach. Then we will talk about competency strategy afterwards. At least write something, whatever you feel that which is hard to teach effectively out of these competency domains. Please join fast. Is there any issue in answering on Slido? Anybody is finding any issue?
Ma'am, I think most of them are having internet issue. Internet issues I am having as.
But at least one person should be able to answer. I'm not able to see even one. At least you write one competency domain which you feel is hardest to teach effectively. Yes, somebody was writing. If you have joined this session, I'm sure that all of you are online. You don't have any issue in internet connection because you are attending this FDP. Please write. Participant, please participate. Somebody was writing, but please click submit in the end. Don't forget to click submit. Okay, critical thinking and clinical judgment. Right. Only one participant has answered. Anybody else would like to answer? Okay, then we will move forward. So this critical thinking and clinical judgment, we will be talking about one case scenario where you will understand that how we can develop the critical thinking or clinical judgment in the in particularly among students when you are teaching certain subjects, right? So that if you are a medical surgical nurse or a pediatric child health specialized nurse or mental health, you might be knowing that there are a lot of emergencies or there are a lot of situations where you have to act fast. How through the case scenarios you can incorporate that so that in simulation or in OSCE, if you are adding those case scenarios, then how the student has to think and then come out with some answers. But that critical thinking and clinical judgment will be developed when the student is having full knowledge about that particular issue. Okay. Skill domain means clinical skill. I think that we are doing every day. Nursing practice clinical skill every day we are doing in lab, everywhere we are doing this. How do you find it hard to teach? Can one person answer about this? That what do you mean by this? That skill domain or nursing practice clinical skill? Why do you feel that this is difficult? Anybody can answer this question. That why do you feel that clinical skill is difficult? If we are talking about health assessment only, is it difficult to teach? Please be interactive. It will be good if we can interact with each other. Please be interactive. If you can just unmute yourself and answer. Students are more hesitant to practice. Actually, what happens, the students are more hesitant only when they don't have knowledge. If they don't have that clinical basic understanding that what that what can be done in this particular scenario, then definitely they will be hesitant. But if we are engaging them from starting onwards, they will be really interested to do that. So somebody is writing, no, it is not difficult as we are practicing each day this one. Yes, that is what clinical skills we are doing every day. We are teaching them in class also. Then the same thing we do it in lab. Then when clinical also, when the students are going, they practice their clinical skills. Okay, so uh, I think thank you so much for everybody whosoever answered. That is very good that at least you have answered something. And I'm sure that by the end of this session, you will be better able to understand at how we can incorporate different innovative methods so that this critical thinking, clinical judgment, skills, this hesitancy to practice, everything can be taken care. Although I just wanted your competency strategy so that how you can manage this so that it becomes easy, but still I hope so that after the lecture you will be better able to manage that. Thank you so much everybody who has answered in this Slido poll. Okay, now coming to very important aspect, innovative aspect, that is simulation and experiential learning. How this particular innovative strategy, particularly simulation experiential learning, safely build clinical confidence before real patient contact. So it is very important, that we need to prepare our students for their real patient contact. This is not that only in the lab, if we are just teaching them the functional activities. This is not that they know that how to do the bed making, how to turn the patient. That is okay. Those are also very important. But at the same time, are we preparing them for certain situations which we may face, particularly how to communicate with the patient? Okay, how to manage certain situations where in first year only, if anybody confronts them, how to answer that? If you are in a team, how to manage the work in a team? That does not come through functional types of activities. That comes through some case scenarios, that comes through some simulation, some experiential learning that can actually happen in your lab only. Okay, so let us talk about that. Now, simulation based learning is very, very important, and Indian Nursing Council has now made the simulation hours also mandatory. You might have seen the hours breakdown in our BSc curriculum, where they have really clearly written that how many hours in simulation has to be added. And also in the end, they have written that 30% of the clinical hours can be completed in simulation. Because this is very important that we need to prepare the students for the safer real life encounter. Okay, so simulation, it replicates the real clinical encounters. We can replicate the real environment. Okay, but it is very safe environment for them. It is a controlled environment, and here, without harming any patient, they can repeat their practice without any risk to the patients. Okay, so that is why this is very important that we need to incorporate simulation into our learning, and it is a core innovation that bridges theory and practice. Teach karna is very important, but actually how to practice that is very difficult. And that gap between that theory and practice, how can we bridge that? Okay, this is very, very important, particularly why it is important. One first thing is patient safety first. The patient safety is foremost. We can't simply allow the students be in real environment without preparing them, because mistakes become learning opportunities, not patient harm. But mistakes, there is no room for error when the student is in clinical area, right? So we need to prepare our students for the critical situations that they can encounter in the clinical area. Okay, so particularly high risk procedures, even if you're talking about IV insertion, CPR, medication administration. Like for example, if I talk about CPR, if we don't teach them in lab, if we are not preparing them in simulation, I think so in clinical area sometimes student may not get any opportunity to be part of CPR team in the ward because they don't allow students to be there. Or even if they are allowed, then students will be really confused because that is a very high stake situation. They will not allow students to do certain activities. So students will be really anxious at the time if the student has not managed that in actual case scenario in simulation. Okay. Okay. Then deliberate repeatable practice. They can keep on repeating the scenarios. They have time in lab. You can keep on repeating and then student can become competent. They will know that where I missed that particular step in the last scenario. Then they can do it again till the time they feel really confident that now they are able to follow. And moreover, when they are actually doing it in case scenario, they will remember that that was the mistake I did at that time. Now I don't have to do it. So slowly, they will be building their muscle memory and their confidence will be developing. And then they'll be better able to practice that clinical decision making, practice that clinical reasoning clearly and in a better way. Then structured debriefing. This is a very important thing. Once the student completes that scenario, the second last step is very important is debriefing. You have to sit with the students. You are a facilitator for the student where we do the reflective debriefing. We ask the student, what have you done positive? What were the plus? What were the delta points? Means what were the positive points? What you did right? What you did wrong? And how could you have improved? Okay, if you're talking with the student without any judgment, definitely students themselves they come out with gaps. They will say, I could not do this because I was not knowing about this, or I could not do this because I was anxious. Okay, so then that becomes a learning moment. You can teach them at the time. Okay, and then student remembers that I did not do this. That is known as reflective debriefing. Okay, this is very important that after the student completes, there should be and then facilitators should not be sitting in front of them. Facilitators should be sitting with them. Okay, so that they should feel open, they can open out, they can actually talk about their experiences when they were doing the activity in the case scenario in the simulation. Okay, the interprofessional practice, multi-role scenario. So here a group of people, a group of students, they can be assigned multiple roles. One person can act as nurse, another person can act as doctor, another person can be pharmacist. That will build a teamwork. And moreover, I would like to mention about one practice which we use here in our university. We have allied health sciences, we have pharmacy, we have physiotherapy, we have nutrition also, lab technology, and nursing. Once in a year, the different students they come together and we perform case scenarios. We do the simulation in a team where one student from allied health, one student from physiotherapy, one student from nursing, one student from pharmacy, they come together and then they do the multiple role scenarios. That actually help them to understand that as a healthcare professional, how in a team they have to work. So that practice can also be done. Okay. Then standardization and fairness. Here, each student experiences the same scenario. So that is a fairness. That is the equitable treatment which we are doing. Okay. So here you are supporting equitable criterion reference assessment. So here when we are doing the simulation practices, you don't have to be judgmental. We don't give any marks to the student. Our simulation based learning should not be for assessment. That is only for learning purpose. And you have to tell it in the starting only that this is not for your assessment. I'm not judging you for anything. Even if you are doing anything wrong, I'm not going to give you any wrong marks for that, or I'm not going to make any judgment about you. We have to be open. Okay. Once you say this statement, students will become really at ease and they will be able to do better in that scenario. Okay. So this standardization and fairness helps in the better learning. Okay? Then is confidence and anxiety reduction, definitely, because student knows that in this is not a real patient. Here I can do the mistakes, but then those mistakes will help them to learn better. Okay, and that helps in anxiety reduction once the student is in the actual situation. Okay, they will have better confidence. Whenever we complete our case scenarios and simulation in our university, in the end, whenever we ask the students about their feedback, they are always very happy. They say that I could understand that where I'm lacking, and it has improved my understanding that where am I lacking and what I have to do. What are my what am I supposed to do further in future so that I can improve myself? And they say that I can do it again and again. So that builds my confidence. So that is very important that we need to incorporate simulation based learning into our curriculum. Okay. Right. So I always listen from faculty members that I could not include simulation in my teaching because we don't have very high tech simulation labs in my university or in my institution. That is not at all needed. High tech labs are not needed. There are different kinds of simulation fidelity spectrum. Okay. There are different emerging technologies which you can use. Even if you don't have any technology available, then also you can use simulation. Okay, so simulation is of different kinds. That can one can be the low fidelity simulation. We use it every day. We use it. Low fidelity simulation. We are on mannequins, static mannequins. We do. We have task trainers. Okay, we have case studies. In case studies, we can discuss with the students. Okay, and these help really to develop their psychomotor skills, particularly the functional assignments. Okay, like for example, how to give the injection, how to do the bed making, but then do it in a case scenario form. That this is the patient of diabetes. He has been prescribed this medication. You are supposed to give this medication. Now let the student read that scenario. Let the student do that on that static mannequin. Let the student do that on task train and let him include each and every step, which includes communication also, which includes your clinical skill also. That is a low fidelity simulation. Okay. Then coming to the medium fidelity. Medium fidelity is a mannequin with some responsiveness, where you can auscultate, where you can check the pulse. Okay. Or if you don't have mannequins with the responsiveness, you can use standardized patient. Standardized patient is a person who act like a patient. Like it can be another teacher, it can be a person whom you can assign the role of a patient. Okay, and then there can be a lot of the person can act as patient, one person can act as his relative, one person can act as a nurse, one person can act as a doctor. Give them a case scenario, let them perform. Okay, but then one facilitator, the faculty has to be there who can change the scenario in between. Okay, like the patient has come in the emergency and suddenly something changes. You say that patient's heart rate is going up. What are you supposed to do? Okay, patient's heart rate is now 150. Let the student see what the student is able to, the student should be doing in that condition. So that is known as medium fidelity. Then high fidelity, here you have the mannequins which have advanced features. Okay, where you can actually change from background. Their heart rate can change, their breath sounds can change, their cardiac sounds can change. You can use it. Sometimes there are inbuilt clinical scenarios also. You can just click on the cardiac arrest scenario. It'll imitate that cardiac scenario. Okay, the patient will be having that deteriorating patient scenarios, the code blue scenarios. So that scenarios can also, but on standardized patient also you can come out with the code blue scenario. Okay, you can utilize medium fidelity. You can, if you don't have high fidelity, medium and low fidelity, simulation can also be done without any high tech manipulation also. So it doesn't mean that you need to have a very high tech lab to conduct the simulation. You can conduct the simulation on standardized patients also. You can conduct the simulation on static mannequins also. Okay. And nowadays, fourth thing is VR and AR and AI driven simulation. Nowadays, there are virtual scenarios. Okay. Where virtually you can see a patient and that patient's condition deteriorates, the patient's condition is different, and then the student has to follow some procedures. and then it gives the feedback also, automated feedback that you have done these steps right, but this step should have been followed by this step which you have missed. So that feedback actually helps the student. I would like just to show you one uh, website. So this is one website, that is bodyinteract.com. Okay, bodyinteract.com. Here, if you go to this bodyinteract.com, it has a lot of um, virtual patient scenarios. So like this, it you will get some diagnosis. Okay, AI driven conversation where uh, AI driven conversation is there. You have a patient, you can see that what is the patient's condition, and then accordingly it asks you that what you are supposed to do. So once you do that, then it gives a feedback that these were the steps which you were supposed to do. So like that you can do. So clinical reasoning in action, real time decisions, realistic outcomes, that is known as virtual simulation. Okay, the virtual patient simulator, that is there. This you can utilize in your institution. Your institution can buy the subscription, and then under that you can help the students to do that. Okay, it includes obstetrics, medical, surgical, child health, every kind of, even geriatric scenarios are also there. So you have virtual patients which range from 6 months to 99-year-old. Okay, so this virtual simulation, the students can keep on doing it on their own pace also. Okay, and they can actually help in developing their critical thinking. Okay, so that is also very important, that you should include something. If whatever you can do through your institution, you can just buy and then you can do it. Okay, and for nursing also, there are, here only if you will go further, I think in resources you have for nursing, for medicine, for nursing, for high school, and for emergency paramedics also. So you can click on nursing and you can see, you can subscribe for the nursing scenarios which can actually help the students to prepare further. Right. So let's go back. Okay. So one thing is there, that whenever you're planning for simulation, please make sure that knowledge is must before your simulation case scenario. First, cover those topics, the topics which you will be including in that case scenario. For example, if you have covered your cardiac unit fully, now you know that the student knows that what is MI, what is cardiac arrest, so that then only they will be able to act in the simulation. Then only you start with the case scenario. So knowledge is must. The understanding of concept is must before simulation fidelity. Okay. Any question till now? Anybody is having any question?
Ma'am, what is the website you told about?
Body interact, bodyinteract.com.
Okay, ma'am. Thank you.
Okay, just uh, I want 3 persons. Anybody can volunteer? 3 persons. Please fast. So anybody, any 3 persons, if you can volunteer, can you just say your name? I'm not able to see the participant window here. Any 3 persons? So this is a scenario where a second year BSc nursing student during a ward simulation administer an IV antibiotic without verifying the patient's allergy history. The patient develops a rash. Okay, and the student notices but hesitates to inform the in charge immediately. Okay, so this happens that you have run a scenario where student has noticed that there is a rash because I have given some antibiotic, but then student did not inform it to the in charge. This is happening in simulation scenario. Okay, now one of you have to act as a facilitator. Can you speak out your name, that I will be acting as facilitator? One person, one volunteer. Be fast. You all are teachers. You should volunteer fast. I'm not able to see the participant window here actually. Otherwise, I could have seen. Can anybody help me?
Participant, please participate. The session will be more interactive.
Yes, ma'am. I'm
Who is
ready to participate. Dr.
okay?
Mosmi.
Doctor?
Mosmi.
Dr. Mosmi. Dr. Mosmi, what will you act as, facilitator or student?
Anything as you
Okay,
like.
then I'll give you the role of student. Okay, right?
Okay. Yeah.
Okay. Any other person? I need two more. Be fast. Thank you so much, Dr. Mosmi.
Thank you, ma'am. Most welcome.
Second person, please. Anybody fast? इसमें कुछ right wrong नहीं है. Nothing is right wrong. We are just preparing, because once you understand how to debrief, then definitely you will be a better educator. Anybody? इसमें हम किसी को judge नहीं कर रहे हैं. Let me give that statement clearly. We are not judging you. This is just a debrief practice. Anybody fast? Any second person? Dr. Mosmi is the first person. I really appreciate her. Anybody else? Co-host, can you name anybody? Just select a name. If they are not volunteering, we can just ask somebody to be part. Dr. Kurbi? Actually, na Google Meet mein, I'm not able to see the participants and I'm not able to check the chat. So if co-host can help me, what are they writing in chat, or if anybody is doing something, so you can just tell me. We have only half an hour left. Please do it fast. If teachers will not volunteer, then how you will make students engagement in your class? Anybody?
Participant, please participate. So session will be more interactive. We all are teachers.
And we are not going to judge anybody.
This session will for all.
Okay, okay. If anybody is not coming, Dr. Mosmi, are you there?
Yeah.
Dr.
Hello.
Mosmi?
Yes, ma'am.
Okay.
I'm there.
So I act as a facilitator. Okay. You just think about a scenario where the student has noticed that the patient had a rash, but then she did not inform. So you just think once that what kind of answers you can get from the students. Okay, here you have to just tell me first that what are the positive points you are feeling here.
What?
What are the plus, what went good here in this scenario?
That antibiotic. Good point, ma'am.
Good point.
Because allergy itself is a good this thing symptom which came up, so that it needs to be stopped immediately. Much of the IV.
No. So see, whenever we are asking the student about good point, what student did which was good? Can you think about that?
No, ma'am. Sorry.
You see, here you have a student who has administered IV antibiotic. There might be one good thing that student has administered antibiotic by using for 5 hours, 5 hours. Okay, student might have used good thing. He might have examined that whether it is the right patient, is it the right medication, right prescription, everything the student has checked. Okay, that is a good thing which I have. Second thing is that student was able to notice that there is a rash. It means at least student was able to notice it. But then what could have improved? It is good that student has noticed that there is a rash. But then student did not inform the in charge nurse immediately. Now, now you have to then debrief. You have to ask the students That what were you thinking at that step? Why you have not informed the in charge nurse immediately? Mostly, what kind of answer the students can give? Students क्या बोल सकते हैं इस time पे?
Students can say that it was said by sister to administer. Patient was going in OT or something, so I was in hurry. I have not checked and I have administered. Like that answers we can get from students.
Okay, so that answer can come, and another a second answer it can come. Ki I was really anxious. I was fearful. That if I will tell somebody, I will be scolded. Okay.
Okay.
Third thing
Yes.
is that student doesn't student feels that this is not my work.
Yeah.
The work of the nurse. It is the work of the doctor to notice it. Okay.
Mhm.
So through those answers, now you have to pick up in your DP. Okay, then you have to ask that what could have improved. Now you understand that then the student will come up with answer that I should have informed. So here then in debriefing you will be mentioning about your checking of side effects of any medication. That is very important. Second thing is you have to you have to talk about um, notification to the senior in case of any side effect. Okay. Third thing is openness by here now leadership also come here now administrative protocols also come. There should
Mhm.
be some SOPs that if anything goes wrong, then you need to report. Don't think about that you will be scolded or there will be something wrong happening. Okay,
Mhm.
like that
Yes.
to debrief so that that debriefing gives you the opportunity to teach.
Mhm.
Okay, then in
Yes.
the end you have to ask the question that what would you do differently next time and why. Then let the student speak out here that I will notice for the side effects, I will inform it, notify it so that timely management. Is it clear? Right? So, like this, any case scenario you can come out and then you can just debrief in the end. Debriefing is very, very important in the end. You have to ask the student to reflect on that what was happening in their mind when they were actually acting out in that simulation scenario. Right? Okay?
Oh,
Okay.
yeah.
Thank you for the
Mainly
question.
we have to allow student to think it critically about each aspect of the mistake or whatever she or he has done.
Yes,
We
yes,
allow them to think more instead
yes,
of coming into judgment. We have to allow them to think and rethink and reflect their own actions.
yes. Because when they rethink and when they answer, they actually understand that what went wrong. And
Yeah.
that particular thing they will not forget their whole life. They will not forget.
2 मिनट रुक जाओ मैं आ रहा हूँ
Please mute yourself a bit. So they will not forget and they will continue because now that will be in their mind that if that happens, I have to do this. Okay. So you are preparing the student actually for the actual situations in the clinic. Right? So please mute yourself.
क्या
Please
हो
mute
गया
yourself. Co-host can mute everybody. Okay, so simulation has three steps, pre-brief, simulation scenario, and debrief. Pre-brief may you have to talk about the scenario clearly. You have to give the statements that we are not judgmenting. Okay, we are non-judgmental. You don't feel that you are just being observed to see that what all steps you are following, and you have to be open when you are doing the work. Okay, and then tell them about the environment also that this is the patient and here is your what is that injection tray, here is your blood pressure machine, here are the control of the bed. Sometimes they have to put the bed head and up, so that everything you have to make them aware of their environment also, and then you run the scenario. After the scenario, then you have to sit with the students, like if there are 4 5 students who have been given different work, sit with them and then reflect on each and every person's uh, thinking, every person's emotions also. You have to talk about that What were your emotions when you were taking care of the patients in this scenario? Then sometimes student may say that I was anxious. Some student may say I was fearful. Some student will say I was feeling happy because I was able to manage the student. Okay. So you have to ask them, and then you do the debriefing with these prompts which I have written here. Like, walk me through what you were thinking at each step, what information you have, and what did you wish you had? How did you feel when you noticed the rash? What would you do differently next time and why? And what systems or supports could prevent this? Okay, so that those questions, answers when come from your students, and then you can actually help them to understand it in a better way, right? Now, coming to the next section, that is technology and digital pedagogies. Now, you see, technology is everywhere now. Now, how to use that is very, very important to you. So, here we will be talking about that how flipped, blended, and AI-enabled approaches extend learning beyond the classrooms. Now, flipped classroom and blended learning models. What happens in flipped classroom? Mostly what happens. हमने एक topic cover करना है. We just pick up that topic and we teach that in class, in full class. We are just talking, and student is just listening. But what we can do is in flipped class that beforehand you just share with them some recorded lectures, some podcasts, or some papers or some e-modules with them so that they can read it, they can see that video and then come to the class. So it means they are half prepared for that particular lecture. Okay. So now here in the class, rather than talking from the basics, this class can be actually be more interactive. It can be devoted to case discussions, problem solving. You may have some case studies also where you can discuss. Okay. Or there can be some peer teaching also where faculty facilitates and clarifies. Okay. And then after the class, students can write, you can ask them to write a reflective journal also, that what were uh, their learning from today's lecture, and what can how that learning can be utilized in the clinical posting. Or you may give them some assignments. Okay. And then faculty that reviews the analytics, then faculty sees that where the gaps are remaining, and that particular gap if you feel is remaining, then you can in the next class, in the first 10 minutes you can cover that. Okay. So that happens in the classroom, that where you send some recorded lectures, some videos, some podcast, or some e-modules before the class, so that student is prepared for the class, and then the class is utilized for interaction rather than just teaching them basics. Okay. Then another method is blended learning models for nursing programs. There can be station rotation. Students can be rotated between online modules, like you may share some online modules with them, then they may come to the lab for doing actually some skills in the lab, and then in the end there will be some group activities for the student. Okay. So the class can be split into three parts, where some online modules the students go through in the groups, then they do some skills, and then they do some in the small groups, then some group activities can be there. Okay, that is a station rotation. Then there is another method is flex model. Flex model, here particularly we use some LMS, which in LMS you can use Google Classroom also, and in that LMS you you deliver your content online. Particularly we used to use Google Classroom during COVID time, when we were not having much time for actual interaction. So here you can deliver your content through the Google Classroom. You take the online classes, put that on your Google Classroom, so that the students can go through those recorded lectures afterwards also, and live sessions also we can take, and they can go through those recorded sessions also. And then if there are any support needed, they can write in the Google Classroom in the interaction, and teacher can keep on answering whatever questions they have. Okay. Or they can be enriched virtual, where it can be face-to-face context, but then fully through online mode we are doing. In flex model, sometimes students can come in contact with the students also, like there can be some personal contact programs in between, where the students can actually ask face-to-face, or through phone also they can connect with them. But here in enriched virtual, everything is through the virtual labs. In here also we can use the Google Classrooms, or notebook LM is also there, which you can use. Okay. So These are the different methods or innovative methods which you can use. Now coming to AI. Now AI is actually disrupting the education, higher education particularly, I will say. You can actually use AI for preparing for your content, for preparing the rubrics, for even for preparing the case scenarios for the simulation, for preparing the case scenarios for OSCEs also. Okay, you can create your content also. You can do literature review through the AI. Okay, so you can use AI virtual patients or chatbots where AI simulates the patient, and then this, like particularly, I have given you body interact. In that, you can take the. It is AI based, and you can take the history also. Okay, the student understand that in history what all aspects I have to cover. Okay, and instant feedback is given by AI. That in history you have asked about these things, but then you have missed these things, which also should have been asked. Okay, then adaptive learning and analytics. AI can understand that what are the knowledge gaps, so that those virtual uh, AI AI backed systems can also give them the feedback, and in feedback they understand that where are the gaps and what are the steps they need to take for that. Okay, and then for literature review and research support, there are a lot of tools. I'll show you those tools if we will have time. Then automated item generation, you can develop MCQs, you can develop OSCE checklists, okay, through the AI. Then you can do the content creation also. You can generate case studies, you can generate your lecture outline summaries, and also in different languages if you need that also through AI you can prepare. And also uh, but then at the same time in your institution you should have the academic integrating tools also. This is not that whatever you are doing is totally dependent upon AI. Your judgment is very very important. Even if AI is giving you something, please use your judgment whether whatever AI is giving me, is it right, do I need to change it. That also is very very important. Now let me show you how can we utilize AI. Okay, which AI tool you most of you use? Can you answer? Anybody can answer which AI tool you use? Can anybody answer? आप लोग AI use करते हो?
ChatGPT and Gemini.
Gemini and ChatGPT. Anybody has used Claude? Actually, ChatGPT and Gemini are there, but I will recommend important AI tool, that is Claude.ai. That is just like ChatGPT, but then Claude AI gives you professional answers. It can actually prepare complete rubrics in Word. It can, in complete information it can give you. So you can just, it is Claude, CLAUDE, Claude.ai. You can go to Claude and you can actually prepare the case scenarios. Let me see, it is opening. Taking time. Okay, so like this. Okay. So there will be a window like this here, like just like Chat GPT. So here you can just say to it, you can give the prompt. Okay, you can give the prompt. For example, you want to develop a simulation case scenario on any topic. You can take on blood transfusion. Okay, and checking for side effects during the blood transfusion. Okay, you have to give the prompt that I have to take a simulation session for BSc nursing second year students on blood transfusion. Okay, please prepare a simulation scenario on assessment and management of blood transfusion allergy or reaction. We will say reaction. Okay. There should be 4 participants in this scenario. Right? Now you have given the prompt, then Claude will give you the simulation scenario. It'll give you the scenario. Now it is thinking, it'll prepare a scenario, and you can just, once it gives you the scenario, you don't have to actually accept it as such. You have to actually go through that scenario. If you feel that something need to be changed, edit it, and then you use that scenario. Okay, fully um, we don't have to trust the Claude or AI. Okay, because sometimes AI can do some mistakes also. Because you are knowledgeable person, you are expert in that particular area, you can definitely know that what is right and what is wrong, and then accordingly you can prepare that scenario. Okay. Now you see it is checking doc skill. So it will come, whatever scenario you will be preparing, it will prepare a doc document. Okay. In the meantime, I will just go back to the PPT. Then we will come back to see the doc skill here. Okay. So you can use the artificial intelligence in nursing education, even for your assessments also you can use it. Okay. So there are different AI tools. You can use ChatGPT or Claude for drafting your case studies. You can give a good prompt. Whatever output you will get, it will depend upon your prompt. If you're giving it a clear prompt, it will give you a very good uh, skill. Okay, you can draft your case studies. You can even prepare your MCQs, but please check it fully. Okay, right? And even your lecture outlines also you can prepare. And actually I prepared this simple sample task for all of you, but now we don't have time, so I won't be able to give you those tasks. Even you can go to you can go to Elicit. You can just put in your Google Elicit, ELICIT. Elicit can help you to do the literature review. You can do the literature review. For systematic reviews you can use Elicit or Rayan, and these are very very important AI tools which can be useful for your research work. And I'm sure many of you might be using quizzes or Kahoot. Like today, I'm using Slido. We can use quizzes, you can use Kahoot, or even you can use Slido, which can give you the gamification and quizzes, which can help in better engagement of the student. Then body interact already you have seen. Then we have VSIM also from Ladle, which you can use. VSIM, you just put VSIM in Google, you will get the link. Okay, and here this is AI driven virtual patient simulation, where the students can actually perform the simulation scenarios in that. Okay, then infographics, if you want to prepare some PPTs or good slides, you can go for Gamma AI or Canva also, and you can prepare good PPTs or presentations for your presentations, right? Let me see whether in Claude we have got the output or not. Let me check. It is still working on that. Okay, it is still working. So let us see, in the end it will give us. Okay, in the meantime, let me go further. Okay, now I think AI tools are clear to you. Now coming to collaboration, very important, collaboration and assessment innovation. Okay, here particularly gamification, collaboration, case-based learning, that can help a lot. Like some of you were saying that gamification is very difficult. Gamification is not at all difficult. You can use, like today I'm using Slido. You can use quizzes. You can use Kahoot. Just go and check it. You will be able to utilize this very well in classrooms when you are teaching. Please use some quizzes. Okay, so that you can see, you can show the leaderboards, that who was the person who was able to answer it first. Students will be really engaged. There will be a positive competitive spirit among the students. Okay, You can use that. There are different kinds of tools available online, like there is math mastery, particularly for dosage calculation of medications, which is very useful for child health. Okay, you can utilize that, where you can prepare some quizzes for the students. Some games are there where students get to know that whether I did it right and what was the wrong, and then it also gives some badges. Then there are certain other tools like code blue escape rooms. So what the students are supposed to do in case of code blue emergency. Okay, so then there are some clinical puzzles, and within some time they have to answer. Okay, then it will give the feedback in the end. Then there is another tool, that is infection control quest, that can also be used. That is also quiz based app, where students, they earn point when they are able to correctly sequence that personal protective equipments, how to don it and doff it. Donning and doffing, they can learn through it, and a lot of infection control challenges also they will be able to get. Okay, so like that, there are a lot of tools. Only thing is, you have to search for those tools and utilize that in your classroom. Okay, so let us see chat clock, if it has come out with something. You see, now it has prepared this blood transfusion reaction simulation scenario. You can actually download it. Okay, it has come out very nicely in the Word format. Let us see in the Word format. So this scenario, it will be opening up now. You see, it has given me very nicely simulation based learning scenario. You don't have to do anything. It has prepared. The only thing is, you have to check whether it has given. You see, it has given you the topic: acute hemolytic transfusion reaction during red cell transfusion, packed red cell transfusion. Your target learners are these. This is a scenario time run. Pre-briefing time, it gives you debriefing time, how much time for actually fidelity, and then fidelity level. There can be some standardized patients who can act as a patient. Okay, right? Now you see, it has given a very nicely scenario overview. Okay, so it has talked about that blood transfusion, what is it and how it will be useful. Okay, then learning objectives also it has given. So you can actually give this paper to the students so that they can prepare themselves for that when you are doing this. Okay, now you see participants and roles. There will be one primary nurse, there will be one associate nurse, one patient, and one physician or charge nurse. Okay, then these equipments might be needed at that time, and mostly these equipments are available in our labs. Okay, where mannequin or standardized patient, your IV line, your second IV line connector, and everything should be the vital sign monitoring, or some tablet you can show it. Okay, then another thermometer, sphygmomanometer, these things, mostly these are available in our lab. And then this is the patient profile and case background. You see, very nicely it has given you the patient. Now, as per Indian setting, it has given. Okay, name, diagnosis, what is diagnosis, what is the relevant history. So students can go. Now, this is the pre-briefing. This is the scenario. It has given very nice scenario that what will be done. So this is the scenario that takes place in the surgical ward, and mannequin patient is in this bed, Mrs. Sunita Devi, 45-year-old woman, who is a 2-day post. Very clearly it has written that this woman is 2-day post-operatively. She is currently receiving the blood transfusion. Now see, these are the particular things which you have to say, that everything you see and hear in this room is part of simulation. Please treat the mannequin or standardized patient as you would treat a real patient. Use real equipment as you would in clinical practice, and speak to the patient and to each other exactly as you do it in ward. So this is very, very important that you tell them that you have to do it. And this is safe, no fault learning environment. Whatever happens during the scenario stays within this room and is intended purely for learning. So you are saying that this is not for individually grading on your performance. We will discuss everything together afterwards during the debriefing. And if at any point you are unsure what to do, you may ask the facilitator to clarify a question by saying, I would like to ask the facilitator, and I will respond either in role or out of the role. This is very important. And then scenario, progression, and timeline. This is given that what will be done at the baseline. Then in phase 1, then you will at 2 minutes into the scenario, then you will say that patient's heart rate is going up, BP is going up, respiratory rate is this temperature is this, then patient will suddenly say that, oh, I'm having chills, and red face, and then patient says, mere back pain ho rahi hai, I'm not feeling well. So that standardized patient can act out, so that the student who is actually acting as a nurse should understand that there is something happening due to blood transfusion. Then you have to escalate. Patient's heart rate, patient's BP may change, patient's respiratory rate may change, temperature may change, and patient is visibly anxious. Okay, so that everything it has given very nicely. Then after that, if the person is doing nicely everything, then how the patient stabilizes. Okay, then in the end, how to resolute and how to hand over everything very nicely it has given. And then in the end, you have to do the debriefing. Okay, and debriefing may you there are a lot of questions which are written, so you can just prepare such type of case scenario for your students. You can just give it a one topic and say that what exactly you want the students to perform. Okay, and this is the observation checklist, which you can also ask one person to observe out of the students only, and that person will tick whether these things have been done or not, and in the end observer can also debrief. So this is a debriefing guideline also, that what happened in reaction phase, what happened in analysis phase. Okay, and in the end summary, and then facilitators note. Okay, so this is very important, that such type of case scenarios, which sometimes when we used to earlier make the case scenarios, it used to take half a day to make a scenario, but now it is very easy using the AI. You can prepare a case scenario where each and every step it gives you till the debriefing. Okay, and you can utilize, but please go through it fully, because sometimes it may have some wrong information also. So you don't have to give any wrong information to the student. That is why as an expert you have to check that scenario first, then you run that scenario in your lab. Okay, right? I hope it is useful to all of you. Any question? Okay, if you don't have any questions, so let's move to these are the fast quizzes. Just to give you the information about quiz. So you can use such type of quizzes. This quiz is not for you, but to just give you an idea that how you can ask the students to join your quizzes. Maybe you can use Slido, you can use Kahoot, you can use quizzes. That is up to you. Okay, so you can just join this quiz. At least one or two persons, please join fast so that we can move forward. I think so it is already 1:32, 33. Actually, we started half an hour late, so that is why it is taking time. Anybody can join? Join the quiz, please, fast. Okay, this is the first quiz. That which assessment innovation uses a circuit of timed clinical stations to assess multiple competency objectives? Objectivity.
OSCE.
You are saying OSCE, but you need to click it. Time is over. It is timed. So like this, you can make it timed, and then you will get here the information that how many of you have answered Viva Voce, how many of you have used OSCE, how many of you have used MCQs or open book test. So if you have used the Slido, please do it fast for the next question. I'm moving forward. Please do it fast for the next question. If you can join fast. So OSCE is the right answer. Whosoever said it, it is the right answer. Okay. Next, no one participated. I can't show you the leaderboard. You will be able to show the leaderboard to the students. Students will be really happy after knowing. The next question is, which model places online pre-class learning before in-class active? Which model places online pre-class learning before in-class active application? Please click. Fast. Click fast.
Flipped classroom.
Ma'am, you don't have to answer. You have to click on Slido. Okay, only one participant has joined. I'm just moving forward. So one participant has very clear, very rightly answered. So that is why it is showing 100. So it will give you the information like this. Okay. Then next question, please get ready. Please join fast. I'll be just moving to the next question. So in Jeffrey simulation, the simulation scenario. After the simulation scenario,
Six three. 6-3. कहाँ से खुला ये ऐप डाउनलोड कर रखा था
this is the timed question. So you can make it timed or you can give any time. Okay. Now everybody has answered. 2 persons or 2 or 3 persons have answered. So it is debriefing. Okay. They have answered debriefing. So let us see debriefing is the right answer. So like this, you can include the quizzes in your lectures. You can use it in classroom also. You can use it in virtual mode also. In classroom, in your PPTs, you can embed it. Okay. And then you can utilize it. Students will be really feeling good when they will see that they are able to answer the they are able to rightly answer the question. Okay. So this is the leaderboard. Now in the end, leaderboard comes. So Dr. Usha Kiran Devi, she got the answer rightly. Okay, in the last question. So you can give the leaderboard information also in the end, and students will be really happy for that quiz. Okay. So that is very important. I think interprofessional education, we have already talked about that here different professions come together. Pharmacy, physiotherapy, your nutritionist, your nurses, you can come together and you can prepare the case scenarios where different kind of persons can be together and they can manage the patient. Okay, that is very important because that should be done actually in the end when they are in 4th year, particularly physiotherapy persons also, students also, if they are in like in their internship, nursing internship, and then pharma D interns. So if they can come together, they can manage a patient. That will be very useful for them, and they will actually know that in a team, as a healthcare profession from a different discipline, what are they supposed to do? That is a very good activity which really helps in students to develop their skills, their competencies. Okay. The same way, case-based and problem-based learnings can also be used. You can use some case-based learning where you can just relate the theory with the application as per the cases when you are discussing. Whereas problem-based learning is something different where you give them some problem. Ask them to sit in groups, let them discuss and come out with some solutions. And then let them present it in front of everybody that what are solutions. And every student will come out with some different solution. You will be amazed at the creativity of the students. Okay. So this problem-based learning you can actually use in your classroom very well, right? Then innovative competency assessment, where OSCE you already know. For OSCE also, you can use AI. Like in AI, I have shown you how to prepare the case scenario. For OSCE, for different stations, you have to write that I want these stations. It will give you the... Please mute yourself. It will give you the complete document on objective structured examination by using the AI. Okay, now talking about portfolios, you can portfolios. You can ask the students to prepare their e-portfolios from 1st year to 4th year, maybe any certification, anything new they have learned, whatever. So they can keep on preparing, adding up into their e-portfolios, and then in the end, you will be able to see that what exactly they have learned all through the 4 years that can actually help you to judge them that what type of competency they have developed through that. Then reflective journaling, I always say that reflective journaling should be part of your teaching because once you have completed something, please take the feedback. Use some rubrics to give the feedback also. Okay, so that their critical thinking and professional growth can happen. Then peer assessments, self-assessment can also be done. Let the students do the self-assessment. Let the other student do the peer assessment for the student. Okay. Then AI-assisted formatted feedback. The same way the Claude I have used, same way you can use. There you can use different kinds of assessment scenarios for this. Right? Okay, now mostly, whenever I ask the faculty members that what are the different barriers that you are not able to utilize the innovation, but they always say that there are time constraints, there are limited training in simulation, there are infrastructural gaps, or there is sometimes resistance to change. They don't want to move beyond familiar lecture-based methods, and they say that there is large class size, it is very difficult, and sometimes they are concerned about academic integrity with AI tools can be used, but then you have to utilize your expertise, your knowledge also to see. But I will say that you have to include innovation. Don't go for complete innovative different kind of activity. You just include at least one innovation at one time. If you're going to take, maybe you can just prepare a timeline in next week at least one innovation I will do. Okay, so that innovation can be a simulation case scenarios, that innovation can be use of problem based learning in the classroom, that innovation can be just including some quizzes in your lecture. So you can think of a one innovation, use it. Once you feel that it really helps, you can keep on using it, and then you can include second, then you can include third. I think so this is the best way to keep on including the innovations or creativity in your classroom. Okay, so this is the action planning for you all. This is your innovation pledge. Please click the photograph of this or click the screenshot. I don't have time now, but you have to write it. You have to write it in your diary, that what innovation strategy from today I will try. At least one innovation you have to write. And which course you will be applying it. By when? Timeline. Give the timeline when you will be using it. And one support I need, maybe some resource. AI is also very good resource. You can ask the AI that I want to develop something. Please tell me what are the steps. Am I doing it in a right way? ये आपका एक friend है एक तरह का AI. You can ask it questions. This will give you the information. Okay. How I will know it work. Success indicator. How you will understand whether through the students' feedback or through their, whether they are able to run that scenario fully, or they feel that they were very happy after this particular innovative method. Okay. So please do this activity by yourself. I'm sure if you will write it, then definitely you will include at least one innovation in your teaching style. Okay. So in the end, this is the closing slide where I would say that start small and align to an outcome. So you can start at least with one innovation and align it to outcome. Think about the outcome objective, that if I'm including this innovation, how it will help the students to develop some competency. Then blend fidelity and technology. You have to blend technology along with your teaching. Okay, make assessment authentic. Make assessment authentic. Use OSCE. Please, now INC has made it mandatory that OSCE should be used during your practical examination. You have to come out of those traditional methods of assessment and start using this OSCE, reflective practices. All these things should be used, and build community and support. If one faculty member has used some innovation, please discuss it with another person. Then that person should be discussing with another person, so that a community is formed where everybody is really wanting to come forward to utilize some one in innovation at least, so that we can have some change in long-term change in our nursing education in India. So that's all from my side. If you have any questions or reflections, you can please share with me. Okay, thank you so much, everyone. If you have any questions, you can ask.
Ma'am, these tools are paid or free?
Free. These tools are free.
Okay. Including this also?
Which one?
Claude?
Claude is free. Claude is free.
Okay.
This is the free version only, which I have used and shown you the case scenario. Right? You can utilize it. Plus, you have to log in, and then you can utilize it. You can prepare anything. Right? You can use it.
Yes, ma'am. Thank you.
Thank you. So, any other question if you have, you can ask, or any reflections, or anything you want to say that I'm going to adopt one innovation. What that innovation will be. Okay, so that's all from my side. Back to the co-host. somebody has raised the hand. T. Pravina. Do you want to ask any question? Okay, please, over to Gangotri, ma'am, please.
Uh, Dr. Harmeet Kaur madam is taking classes very well. She include all topic, whatever she can provide it. The topic include enhancing curriculum design and teaching competencies. In that, she included the changing healthcare and learners landscape. In that, shorter attention, diverse entry pathway, traditional to transformative curriculum design, core principles and innovative curriculum design. In section second, she include competency-based education, include knowledge, skill, attitude, challenges, communication skills, and delegation and time management. In section three, she includes simulation and experiential learning. In that, clinical confidence before patient contact is necessary. In section 4, she included technology and digital pedagogy, and last section, game-based learning and interprofessional education. Everyone is involved very well. Even though faculty members are hesitate to involve in quiz question, so we can understand the how student can participate during classes or other things. So it is necessary that each and every student can engage in classes so they can understand very well during classes time. Thank you. Thank you, ma'am.
Thank you, ma'am. Thank you.
We sincerely thank our resource person, Dr. Harmeet Kaur Kang, for delivering such an insightful and informative session. Your valuable guidance, expertise, and time are truly appreciated. Thank you, madam, for sharing your knowledge and making this session meaningful and engaging.
Thank you, ma'am. Thank you so much for this wonderful opportunity to interact with so many faculty members from Jabalpur. I think the national level, not only.
National.
Yes, yes. So thank you so much. Thank you, Dr. Princey. Thank you so much for this opportunity.
We extend our sincere gratitude to the chairperson, Dr. Professor Gangotri Khairwar, for gracefully chairing the session. Your valuable presence, guidance, and thoughtful remarks added great significance to the program. Thank you, madam, for your support and encouragement throughout the session. Dear participant, as we continue this journey for learning and growth, we are excited to invite you all for our upcoming session. Session 3, topic Leadership and Management Skill for Nursing Faculties. The resource person will be Dr. Professor Ramesh Chandra Babu, Sri Ramchandran Institute of Higher Education Research, Pro Route, Chennai. The session will focus on leadership and management skills for nursing faculty to ensure effective teaching, curricular implementation, student development, and the smooth functioning of nursing education institution. We encourage all participants to join and benefits from this insightful session. Now it is my proud privilege to propose the vote of thanks. I express my sincere gratitude to the resource person, Dr. Harmeet Kaur Kang, madam, for delivering such an enlightening and engaging session. Madam, your valuable insight have truly inspired us. We extend our sincere gratitude to the chairperson, Dr. Professor Gangotri Khairwar, for gracefully chairing the session. I extend my heartfelt thanks to our respected principal in charge, Professor Dr. Princess Saji, for her constant support and encouragement. I would like to extend my deep appreciation to the IQAC team of Jabalpur Institute of Nursing Science Research for their excellent planning and successful organization. My sincere thanks to all the organizing committee members for their dedication, teamwork, and tireless efforts behind the scenes. I would like thanks to all the faculty members and participants for their active involvement, enthusiasm, and keen interest, which made today's session interactive and meaningful. A special thanks to the technical team for ensuring the smooth and uninterrupted conduct of the virtual session. With this, we come to the end of today's session. Thank you all for your valuable presence and participation. We look forward to seeing you in the next sessions. Every Sunday